then I would like to take this opportunity to welcome everyone to Wednesday Wellness, which is a free live educational series by Trinity Health. And we are so happy that you have joined us here this afternoon as we dive into this important topic of supporting mental wellness in kids. But before we get started, we do have a few just housekeeping notes. Your cameras and microphones have been turned off to ensure a smooth experience. If you have questions during this presentation, we ask that you please use the Q&A chat feature, which is located in the toolbox at the bottom of the screen, and we will address these questions at the end of the presentation. And lastly, today's webinar is being recorded, and we will share a link of that recording via email over the next several days. And without further ado, it's my pleasure to introduce pediatrician Dr. Mac Fountain.
Thank you guys for coming. We're really excited. Wanted to talk a little bit about mental health in kids. Hopefully, well, you all know kids, and whether you're a parent or not, I think that we can all help the kids in our life grow to be happy, healthy, mature adults one day. So that's kind of what this is about. I wanted to talk a little bit about each stage of childhood and what we kind of experience during those times, as well as how we can help them. And then a little bit of the medical side. I don't want to dive too deep into it, so that way we're not getting deep into the weeds of things, but I did want to talk about certain medications that you might see kids, if that is the decision between parent and doctor to start medication, so that way it's not the first time you're hearing it when you're at the doctor's office. But first, I want to talk a little bit about who am I. We're going to go through each stage of childhood from infancy, toddler, school age to teenagers, and then what you can do to help. So a little bit about myself. My name is Mackenzie Fountain. I normally go by Dr. Mac. I'm a pediatrician originally from Alpena, Michigan. So like we're all Michiganders, right? Way up here, kind of by Mackinac. I went to undergrad and did my medical school training at Michigan State. Go Green, for those that also like Michigan State. I completed my residency in Detroit, and then I worked in Dearborn for a couple of years. Now I moved over to Grand Rapids with my wife. Very excited to be on the west side of the state, closer to family, closer to nature. Always a big thing, things that I love. Some of my passions within medicine are mental health and then underserved populations, specifically kids experiencing homelessness or those that are in shelter-based care are some of my favorite things to talk about and help with. And then outside of that, I really love to cook and I play tennis. Just a little bit about me. But then kind of wanted to go through each stage of life as a child, and talk a little bit about it. So we're going to start with infancy. So infants are constantly growing new pathways in their brain. Day by day, we are learning if I cry, parents will pick me up, they'll feed me. I need to make noise to tell people that something's wrong with me, kind of those very early on pathways. Something that I always found interesting is that the brain actually doubles in size in the first year. So we do a lot of growing in our brain and our pathways through our brain to try to figure out if I do this, what happens here? How can I get this to do this? Um, big things that we think about in infancy are having a safe, stable, nurturing environment. We're going to talk about that quite a bit throughout this talk. But that just means that someone's always there for the infant, right? They can't do anything really on their own. So they always need somebody, a safe, stable relationship, whether that be mom, dad, grandparents, guardians, um, anyone in the home that can be there for the child consistently. Um, and then something that we always talk about with new parents is to serve and return. So interact with them basically is what we want is uh, if baby's cooing with you, coo back. You know, you don't have to always do baby talk, but talking to them while they're cooing at you. Sometimes I always joke around 5 to 7 months at some point, they're going to learn their voice. And if you have had kids in this age group, you know that they will just shriek for no real reason except to hear their own voice. Once they do it the first time, they kind of stop and look around and they're like, wait, was that me? And then they'll do another little scream or another little shriek. Um, just to hear that they did it and they're learning and they're exploring themselves. During that time, just talking to them, playing with them, just interacting as much as we can. One of the biggest things that we can do for our kiddos is to read to them. I always recommend reading before bedtime, making kind of a solid bedtime routine. Typically, that's a little bit later on in infancy, because the first few months, obviously, you're just sleeping and eating and pooping and peeing as a baby. So, um, but once we start to get closer to having a bedtime, having more of a routine, being able to read to our kiddos and interact with them is really going to help. Obviously, we do recommend avoiding excessive screen time. Typically, no screen time in infancy is what's recommended. Um, and if we do screen time, it should be not a fast pace scrolling through TikTok, whatever, but something a little bit more consistent. And whether we want to put on a small video to help learn some phonics, learn how to talk, learn how to say um, our letters. That's kind of a little bit different than just something that's going to be really bright and flashy because that can be really distracting for kiddos, for infants especially. Um, Something that I always kind of hear from parents is different methods for sleep training. There's obviously a couple that we talk about. Kind of the more old-fashioned one is the cry it out method. You let them cry and self-soothe as long as you know that everything's okay. The Ferber method is a little bit more forgiving, but the biggest thing with that is always coming in and telling your child that they're safe, that you're there, and that you'll come back in a couple of minutes. Typically, that's what I always recommend, um, is the Ferber method more so than the cry it out method, but each family's a little bit different. Ferber method, it's all about um, making those gaps a little bit longer. So as they're trying to sleep, and then if they start crying, maybe let them cry for a minute or two and then come in. Try not to turn on all the lights and everything, but then come in, give them a pat on the back, say that you're there and that they're safe and that you'll be back in a couple of minutes and just keep going with that process. Um, but one of the things that I always want to tell parents is that you can't really cuddle them too much. They're infants. They really need that connection, especially in the first few months. So in the first few months of life, we're still uh, getting to explore our surroundings. So as an infant, when we're first born, we kind of only can see about a foot in front of us. So I always tell parents it's kind of that measurement from if you're holding them in your arms like this, they can see your face. So right now they just need all the cuddles, um, as much as you can give, but also it's okay if you have to put them down. That's totally fine. A lot of infant mental health is also parental mental health. So if we're ever having troubles with uh, breastfeeding, frustration from colic, things like that, I always tell parents that their mental health is just as important. And if it ever compromises their mental health, then to set baby down, let them cry it out and walk away. We don't want any kind of frustrated shaking of baby or anything like that. That can unfortunately happen when we uh, try to give too much of ourselves to the infants. Uh, so things that we can do for infant mental health, just make sure you're there, having a consistent presence, but doesn't always, you don't always have to be on for it, just holding them, being close. This is a really big time where infants explore their environment. They're learning to do everything. They're learning to lift their head up, to look around. By 2 months, we kind of want them to see across the room, so they're learning all about that. Um, they're sitting up, they're rolling, they're hopefully trying to crawl. Maybe they might be walking along furniture at this time. So they're really, really pushing their boundaries. And they do it because they expect somebody to be there in case something happens. And something will always happen. There's no perfect first year of life where a baby doesn't fall or something like that, but just making sure that you're always there for them. And then there's this really interesting concept called neuroplasticity. That basically just means that our brain is making all those connections so quickly that our brain connects things based off of how our environment reacts around it as well. So our baby's brain can grow and change based off of their experiences and specifically their feelings of safety. I'm going to talk a little bit about that when we get into the toddler thing, but that is A huge thing, especially in the first few years of life, is this concept of neuronal plasticity, basically meaning that our brain cells can morph and kind of go from one pathway to another based off of what's going on around us. Okay, so to talk a little bit more about toddlers, so the terrible twos and more. Obviously, we've all heard about the terrible twos. What do we kind of expect to see during this time? Temper tantrums, fits, fun curiosity, sometimes aggressive behaviors, and sometimes anxiety as well. Some things that we can do to help with all of those. Really, a lot of the terrible twos is that we're growing and our body is getting all of these fantastic developmental milestones, and we're starting to be able to do a lot more things with our environment. But our basically, how I'd like to explain is that our brain hasn't caught up with our body. So a lot of the terrible twos, whether that happens around two or not, tends to happen around growth spurts and when we can start exploring things, but we don't, our brain can't catch up to exactly what we're doing. So we get really frustrated very quickly. We may throw ourselves onto the floor, things like that. I'm sure you guys have all seen it before. Um, that being said, the best way to do it is to discuss their emotions, try to talk them through it. When we're in the middle of a temper tantrum, that might not be the best time, but allow them to test their environment, give them safe boundaries. If they're screaming and crying on the floor, then they're okay. If they are slamming their head up against a wall, that might be a little bit of a different story. But just making sure that they are safe and uh, well taken care of, even when they don't understand that they need to be safe. Um, Setting boundaries is really important at this age, and then sticking to them is a big thing that throughout all of childhood will be a huge thing. They're going to want to test their boundaries. Um, Toddlers and teenagers, very similar in that sense, um, will want to test their boundaries. So trying to stick to the boundaries that you've made will help the child learn and have consistency in their life, which is a huge benefit to their mental health throughout all of childhood. And then still this feeling of having a safe, stable, nurturing relationship, whether that be parents, grandparents, pastor, priest, um, anyone in their life that they feel like is always there for them and that they can talk to, is going to be a huge thing. We're going to talk a little bit about one of my favorite topics, and I could honestly talk for an hour about this alone, ACEs and pieces. So ACEs stands for Adverse Childhood Experiences. Um, there was a huge study done in the 80s where basically they looked at all of these things in the top right corner here. They asked adults if they had experienced any of these things, basically abuse, neglect, or household dysfunction. And they asked them these 10 things. Have these things happened to you? And then they looked at what chronic health conditions that they had as an adult. Um, they found that if you had more than three ACEs, or any of these three things out of the 10, that you are more likely to have chronic issues of high blood pressure, even stroke, heart attack, all of these things. And it's kind of all about living in a place where you may or may not um, feel safe, or you may not realize it, but um, as a child, when you're at home, you always had this kind of little bit of stress going on, and living in a stressful environment can kind of add to these chronic illnesses. Um, that being said, we have these great things called pieces, which are positive childhood experiences that kind of help interact or counteract these ACEs. That being said, most of us have grown up with at least one or two ACEs throughout our lives, and we grow up to be happy, healthy adults. But a lot of the times it's because we had what we call these pieces, which are kind of in the bottom right-hand corner here. So that and which kind of all together pieces show a safe, stable, nurturing relationship. So some of them are that you are able to talk to your family. You have a sense of belonging in high school. You have a community where you're able to participate in. you feel safe and protected in your home. You have other friends. And one of the biggest ones is having at least two non-parent adults who took genuine interest in you. So they found that if that was the case, that you could kind of counteract these adverse childhood experiences um, to help bring down that kind of toxic stress level throughout our childhood. Kind of have that, okay, take a deep breath. You're with somebody who cares about you, and that's really all that matters. Um, that being said, I don't want anyone to feel bad or be ever concerned if they have contributed to any ACEs for their own kids or kids around them. It is bound to happen. Obviously, abuse and neglect are kind of different things, but more the household dysfunction. As long as we're able to have some of those pieces or some of those safe, stable, nurturing relationships, it can really counteract those. And the child will grow up to be happy, healthy, with no concerns. They actually found that if we have these pieces or positive childhood experiences throughout our life, um, looking at images in our brain, not to get too into it, but it's really interesting. They found that it can decrease the size of the amygdala, which is what I put over here. So the amygdala is our fear center. If you look at a spider, it goes to our uh, visual processing, goes back to our other visual processing, and then goes to our amygdala to tell us we're scared. Um, that being said, they found that if you have positive childhood experiences throughout your life, you actually have a smaller amygdala than most people, an increased limbic center, which is kind of your fun, carefree, I'm having fun center. So if we're able to have these safe, stable, nurturing relationships, it's been shown that through imaging that actually our brain responds to it, and that's kind of that neuroplasticity that I was talking about earlier. Um, that's as far as in the weeds as I want to get about that, but it's very, very interesting. And all of it to say that as long as we have a couple of safe, stable, nurturing relationships, it really helps reduce the amount of anxiety, depression, heart disease, blood pressure issues later on in life. So whether you can be that for somebody else or you can be that for your kids is fantastic. Okay. So a little bit about medications at this age group. We try not to do too much medications because they're adapting to their environment, they're learning, they're growing as much as they can. Um, but we kind of have this fun balancing act always in life, but especially in kids, about our sympathetic and parasympathetic nervous system. Big fancy words to say our sympathetic is like the fight or flight, I'm scared, versus the parasympathetic, which is I'm at home eating a meal, relaxing with my family, having a fun time. And that tends to be what we look at a lot for kids in this toddler age group. So sometimes if our sympathetic, our fight or flight uh, system is winning out in this balance, we see a lot of aggression, distractibility, kind of what may look like ADHD in young kids, and then emotional dysregulation and the inability to regulate our emotions. So typically with these kids, our sympathetic nervous system, the fight or flight system, is really winning out. They're constantly stressed. I guess if you guys think about it, if you were stressed all the time, you might be a little bit more aggressive. You might not be thinking clearly, and you may have a lot more temper tantrums. That's not to say that temper tantrums aren't normal, but sometimes kids at this age group will say that they fully see red and they don't remember anything that happened to them after trying to punch a hole in the wall or something like that at this age group. So what we do as doctors, we obviously talk, we try to make sure that everything else is okay. And if we think that medication might be helpful for them, talk to parents about what medications. Typically in this age group, we have two medications. If you've ever had a kiddo on these, you may remember them, but guanfacine and clonidine, those two both help decrease that sympathetic, that fight or flight system. Um, a lot of things that we look out for with these are it decreases your stress level. And so your parasympathetic, your kind of resting, relaxing system tends to go up a little bit. A lot of times it's a little bit of a medication that might make you a little drowsy, so we recommend giving it at night. Sometimes it does spill over into the daytime, so that's something that we kind of have to worry about. Some kids will have a little bit of lightheadedness with it. So we always want to make sure that that's not happening. If it is, then obviously talk to your pediatrician. But those are kind of the two big medications that we talk a lot about in the toddler age group as far as mental health goes. That's not to say there aren't other things, but those are the two big ones. Okay, now I want to talk about school age kids. Spend some time because this is where we get a lot more empathy. We get a little bit more nervous about interactions. Imagine your kid on the first day of school or your kid that's going into fifth grade and wants to make sure that they look good for their first day of school. They're nervous about their class. They're nervous about who they're going to sit next to, which can happen in the more toddler age group. But once they get there, they just get really excited that they have new friends. These Once we're in school age kids, especially upper elementary, we tend to see a bit more of nervousness and anxiety about our friends and everything. Um, we have more aggression or ADHD concerns. Phobias and things like OCD start to appear at this age. Sometimes you'll see it a little bit in the toddler, but it really, really comes to a head in the school age kiddos. We start getting bullied. We start talking about peer pressure with other kids. And one of the biggest things is that we start understanding death, which can bring a lot of emotions. If um, grandma or grandpa had passed away or something like that, we start seeing a little bit more of that um, finality of life. And typically around like 6 years old is when we can actually start to talk about death with kiddos and make it be permanent, not just that they're sleeping or something like that. If you've ever tried to talk to a little kid about it, which can lead to a lot of depression, anxiety, and even some PTSD in kids, depending on what happened during that time. Um, for the most part, I really wanted to talk about ADHD because this is a huge topic in school age mental health. A lot of kids, in order to diagnose ADHD, one of the biggest things that we need is that the behaviors that they are exhibiting happen in two different environments. So a lot of times what we do if parents are ever concerned is that we send them home with forms, which has a bunch of questions saying like, do you have to tell them multiple times to do something? Do they not understand things? It has so many questions that help us kind of explain what kind of ADHD they might have, if they have any other co-founding things going on. But we also ask that one parent fills it out and at least one teacher fills it out. A lot of times, what we see is that sometimes if the parents don't have any concerns and the teacher has a concern, maybe there's a learning disability that we don't know of. Maybe there might be some level of dyslexia or something like that going on that is going unnoticed, and they're just acting out because they don't understand the assignment or something like that. A lot of times, if somebody acts out during math class and that's the only class that they act out on, then I don't think it's too much about ADHD. I think it's more about are we able to uh, see our numbers correctly and do they get jumbled up in our head? Do we have this thing called dyspraxia? Things like that. Um, So we always try to send parents home with at least two forms, one for a parent, one for a teacher, so that we can see whether or not it's happening in multiple environments, because that's really the telltale sign of ADHD. Obviously, we have some hyperability, we have distractibility, all the common things that you think of when you think of ADHD. Um, so once we get those forms back, if we think that if they kind of will score out the forms to make sure everything's okay with all the other mental health disorders that we might be thinking of, like oppositional defiant disorder, some PTSD, things like that. Um, so if we make the diagnosis of ADHD, we always talk about medications, and I kind of wanted to bring these up because there's um, kind of three big categories. I threw the antisympathetics, which we kind of talked about in the toddler age group as well. Those are considered non-stimulants, but I kind of put them in their own group because they have different side effects and things to look out for. But want to go through them really quickly. We don't have to talk about every single one individually, but we have our short-acting ADHD medications. Those are typically our Ritalin, Adderall, Focalin, if you've ever been on any of those or had a child on them. And we have longer acting ones, which are basically the short acting, but an extended release version. The big one that kind of changes there is Vyvanse. That's a different one that typically acts a little bit longer. A lot of times, we'll start with the short acting ones to see how they tolerate it. And um, a lot of times we'll hear that maybe it works up to lunch or it works throughout the day and we're totally fine. But sometimes if they say like it only works up to lunch, then we switch to a longer acting one to see how they react to that. Those typically have anywhere between an 8 to 12 hour window of effect. The short acting ones typically work somewhere between 4 to 8 hours. Um, so we don't want to just shoot to the long acting one if we don't have to, but a lot of times, uh, if there's a concern, it's mainly when the parents come back for a check-in. It's that they do really well in the morning and then all of a sudden they're back to their crazy self in the afternoon or something like that. Some of the things that we want you to look for when we're dealing with these stimulants, so they're short acting and long acting stimulants, are appetite suppression. So we always recommend taking in the morning after you eat breakfast. A lot of times kids will not feel the need to eat lunch, so they might come home and be really hungry. That's okay to give them a bigger snack or almost a full meal if they didn't eat any lunch. Insomnia or not wanting to fall asleep at night, we are giving them a stimulant. So if it's lasting too long, it may affect their bedtime. Sometimes we'll have headaches and stomach aches. That's something that we always want to watch out for as well. And then we kind of have this coming down effect. So it's kind of being on the stimulant, riding the stimulant all day long throughout school. It's making us very focused. It's making us pay attention in school. And then at some point when it starts to wear off, sometimes those behaviors that we were suppressing with the stimulant come back in full force. So some people will say, yeah, they're totally great. And then at 5 p.m., they become even worse than they were before. They become like a nightmare of a child, as much as you love them. But sometimes we have this coming down effect, and it's always something that we want you to bring up with us in case it is happening. Almost every kid will have some kind of thing where parents will say, like, yeah, they all of a sudden got really hungry around 5 p.m. But if there's ever any like aggression or behavioral changes that way, that's something that we would really want to know. That's why typically when we start ADHD meds, we want to see you back within 2 to 4 weeks. So that way we can watch for all these things. We can look at the weight and make sure everything's going okay. We can make sure that they're not having headaches, stomach aches, having too much aggressive behaviors or anything like that as they're coming down, and to make sure that they're sleeping well. One of the other big classes are what we call non-stimulant ADHD medications. Some examples of that, Strattera, Qelbree is kind of a newer one. Wellbutrin, which you may be familiar with as more of like an antidepressant and whatnot, can be used. But it's typically kind of we've tried a few things and now we're going to a little bit of a not very commonly used one for ADHD. That being said, Strattera is a pretty common one for our non-stimulant ADHD medications. But some things to look out for. Sometimes they will have some nausea, some dry mouth, some constipation. So I kind of tell parents like it almost slows everything down a little bit. It slows down our saliva, it slows down our stomach gut because it makes us a little bit nauseous. It can slow down our gut in general to cause some constipation. Some of them can cause drowsiness and dizziness as well. Uh, Qelbree is one that can cause some drowsiness, so we typically recommend doing it at night, but it's good for a full 24 hours. And then lastly, we have our antisympathetics. A lot of kiddos, I will put on these kind of this category if I'm worried that they have a lot of adverse childhood experience, if they're kind of living in that toxic stress, if they're living more in a stressful environment. But clonidine and guanfacine, like we talked about for toddlers, the side effects for those typically are dizziness, lightheadedness. You can have some electrolyte abnormalities, so it is recommended to get your blood drawn at one point, and then some drowsiness as well. Okay. I want to talk a lot about teenagers, because this is where we have been seeing more of an epidemic of anxiety and depression. So what happens in our teenage years? we get this thing called the spotlight effect. It kind of happens middle school to high school, but the spotlight effect is just the belief that everyone's eyes are always on us. Like that scene in a movie where the person goes to school and looks like all disheveled, and the whole school stops and just looks at them. Obviously, that never happens in real life, but it's that belief in our teenage years. Our brain has not developed to understand um, that that's not happening, but our brain truly believes that we are kind of always in the spotlight, that no matter what we do, if we trip in the hallway, that's the most embarrassing thing in the world, and everyone is paying attention to that. Where in reality, maybe like four people saw it, and it's, oops, sorry. Yeah, and like four people saw it, and it's not that big of a deal. Um, the other thing that's happening in the our high school age teenagers are anxiety, depression. This is the kind of the part where eating disorders might uh, come out more, and then PTSD. So for anxiety, typically the signs and symptoms that you want to look for are avoidance. We're avoiding school, we're avoiding our extracurricular activities. And it's not that we don't want to do them anymore, we just don't want to go because we're so anxious about being in front of certain people, just general anxiety about maybe we are nervous that we're going to get sick in front of people. So, things that your kiddos will complain about are stomach ache, palpitations, or kind of feeling your heart like it's beating out of its chest, and then trouble sleeping. They're often I'll hear like, yeah, I just can't stop thinking at night. I just can't stop, no matter what it's about. It's not even about anxious things, but I just can't stop thinking. Kind of ways to differentiate that from depression because we can see a lot of the same signs or symptoms of anxiety and depression, but it's all about why they're doing it. So depression, sleeping all day, maybe not sleeping at night, they get this feeling of guilt or loss of interest. So in anxiety, we might be skipping things because we're nervous about it. In depression, we're skipping things because we just don't care about it. We just have a complete lack of interest of going to school, seeing friends that we used to see, um, being in extracurricular activities, doing soccer or basketball or band that we used to do, or robotics club or something like that. Kind of that I just don't care about it anymore. Not to say teenage years we're learning things, we're kind of getting pressured from our peers about things. So sometimes our what we used to like does change. But normally when that happens, we see that we switch to something else. In depression, it's just that everything that we used to like just gets tampered down and they just don't care anymore. Another thing that we can see in both anxiety and depression is our appetite changing a lot. A lot of times in anxiety, our appetite is changing because we have stomach aches and we just are worried that if we eat, it'll make our stomach ache worse. A lot of times in depression, we just don't feel like we want to eat. And then also some sluggishness. Kind of similarly, everything kind of slows down. In eating disorders, this can be really hard to tell at this age group. A lot of teenagers are pretty good at hiding it, to be honest with you. But that's why we want to see them and talk to them at the pediatric office. We always kind of talk about this at all teenage visits. But some things that you may notice, we're avoiding the dinner table. When we are at the dinner table, we don't eat a whole lot. We're overly concerned with the fit of things. Either we're wearing really, really baggy clothes so that nobody notices that we're kind of um, that they may think that they're more heavier sets. So they wear baggier clothes so that nobody can really tell how big or how small they are. If they're fully aware that they have an eating disorder, they may wear baggier clothes to kind of help people hide it. And then one of the biggest factors that we always get concerned about is loss of bodily function. So particularly in our teenage girls, if our eating disorder has gotten to a certain point, we actually stop having periods. So that is a really big sign that we're not giving our body the nutrition that it needs, right? Because sometimes we see this in athletes too, that also aren't giving their body exactly what they need for the amount of activity that they're doing. They may think that they're eating like a normal person, but they actually need to eat 500 to 1,000 more calories a day. and we actually stop losing our periods. And boys, sometimes we can see kind of a halt in puberty because the nutrition isn't allowing us to grow like we should. We don't have as much hair on our body um, as we think we should, and we kind of may have started puberty and we kind of stop and stall out a little bit. So that's always something to look for in your teenage boys. And then PTSD kind of has this very interesting age group of especially our young elementary school kids and high school kids. So, signs and symptoms of PTSD, exaggerated response, a door closes and they freak out and get really anxious and maybe angry. They're having trouble sleeping, a lot of nightmares that we see, and they kind of just detach from a lot of people. So PTSD can look a lot like depression, and anxiety as well. So if we're ever concerned, being that safe, stable, nurturing environment that you've always allowed the child to be in throughout all of childhood will help them talk to you about what's going on and kind of help defining those emotions. Because at this age, we're really learning how to define specific emotions. As early elementary and toddler, we talk about mad, angry, sad, kind of things like that. But now we're talking more about what is anxiety, what is depression, what is uh, like being scared. How does that change how you're doing? Um, if any of you guys have seen Inside Out, I think that's a great movie for kids. The first one is a great movie for younger kids. The second one talks a lot about anxiety and how it can affect joy, but you can have both at the same time. Um, that is really good for young teenagers to watch as well. Even if they watch it as a kid, I think it's always a good thing to kind of put on for our young teens to kind of get them to realize that that is okay and that's a part of life, but we got to talk about it at least, right? Okay. So I wanted to talk a little bit about medications for all of these things. Um, so for anxiety and depression, I'm not sure if any of you guys have ever been on medications for this before, but the big classes are SSRIs, SNRIs, all affect some chemicals in the brain. Lexapro and Prozac are two big ones that we talk about with kids. Effects are in Qelbree. Qelbree is also something that we talked about for ADHD meds. And then in very, very rare cases, we talk about benzodiazepines, if you've ever heard that, like Xanax or Valium. We try to avoid them a lot in kiddos. And then beta blockers will help with the physical manifestations of anxiety. So beta blockers will help it so that your heart doesn't race when you get so nervous. And we find with anxiety, especially, we have this kind of our brain starts feeling one way, our body starts doing something because our brain starts feeling that way, and then our brain perceives our body doing that. So you might be a little nervous that you have a test coming up, and then all of a sudden your heart starts racing a little bit, and then your brain feels your heart racing, and it just kind of keeps rolling downhill until we have a panic attack or something like that, which is what we're trying to avoid, right? So really important for these medications, for most of these medications I'm going to talk about, is that for anxiety, depression, typically it takes about 4 to 6 weeks to see improvement. And we might see a boost in energy. It's kind of the first thing, especially for our kiddos that are depressed within the first 2 weeks. That being said, some kids that are depressed, we do worry a little bit. So we always ask parents to keep an extra eye on them during the first 2 weeks because if they've had anything like suicidal ideation or anything like that, um, those first 2 weeks, you may still have those depressive thoughts, but you are starting to get energy now. So it's a common time where we see um, some suicidal ideation become suicide attempts. So we always ask parents to look out during this time period. That being said, with all medications, throughout all the medications that we've talked today, we have this philosophy about starting low and going slow. That just means that we typically start with a low dose of whatever medication we're going to try, make sure we don't have any side effects, see if we have any benefits from it, and then we may titrate up or bring up the dosage from there, depending on what's going on. So if I start a kid on 5 milligrams of something and they're doing well when I see them for the first visit follow-up, they don't have any side effects, but they're not really feeling the benefits of it, I'll go up to 10 and then have them come back. And if we're still not having any side effects and we're starting to feel a little bit of a benefit, we'll have a conversation about whether or not we want to go to 15 or not. We kind of always want to start at the lowest dose available and then inch by inch go up, just to make sure that we're not hitting any of those really bad side effects. Eating disorders, typically, depending on the severity, may have to be hospitalized. There are certain criteria. The biggest thing is that when it starts affecting your body, sometimes we'll have a lower blood pressure, sometimes we'll have a lower heart rate. That's kind of when we need to start talking about uh, going for the first few days in the hospital and kind of uh, starting a whole refeeding process. That being said, they can also take SSRIs to help with the anxiety and whatnot of eating disorders. Lexapro and Prozac are pretty good ones. There are some things that we put kids on for more mental health things like schizophrenia and whatnot, that can actually cause a little bit of weight gain. So sometimes they'll be on that, like olanzapine or Abilify. Abilify kind of helps with mood as well, so it's kind of a good one. Overall, it can help with anxiety, depression, and the mood in general. And then for PTSD, we have very specific therapy techniques. So always getting in with a very good trauma-based therapist. Um, SSRIs and SNRIs are a good starting point. We also have a medication called Prazosin that will help with nightmares. That's very specific for PTSD. Some people maybe put on it for blood pressure issues and things like that, but more for in our population, it's used for PTSD and having like very specific nightmares. And then also we could do something called then that benzodiazepine class if need be, if we're having panic attacks all day. But the biggest thing, and if I could have you guys leave with one thing about today, is that all mental health disorders should be seeing a therapist. Medications are great. They will definitely help in the meanwhile, but they need to be seeing a therapist. Anytime I start a kid on any medication, they have to be seeing a therapist at the same time. Medication will help with the chemical part of the brain. Therapy will help with the brain itself and those pathways forming, to make new pathways so that we don't just go into the same downfall when we stop medications, because that's always the goal, right? Is that eventually we're going to stop the medications. But if we're going to therapy, we've learned new pathways, we've learned how to cope with it. We don't need the medication anymore. So therapy, therapy, therapy. I always recommend therapy, um, even if the kiddo isn't too concerned. If they're willing to talk to somebody, I would always recommend it. I think everyone should see a therapist at least once in their life, learn some really good coping mechanisms for anxiety, depression, whatever may happen in their life. But I genuinely think everyone should go see a therapist at least once in their life. Um, yes, therapy, therapy, therapy for every single thing we do. Toddlers, there's even infant mental health therapists. A lot of times, what they do is kind of are therapists for mom and baby, and dad. Do a little bit more family therapy. But toddlers, school age kids, teenagers should all be seeing a therapist if we're talking about any of these medications or any of these diagnoses. Okay. So next steps. What do you do if you're concerned? Step one, talk to your doctor. Step two, get in with therapy. That's going to be the most important. And then step three, if starting a medication is right for you and your child, then follow up and look for side effects. Okay. Just want to say thank you, and I want to say thank you to all the people that I put on this screen who were my biggest supporters throughout my training, have helped me throughout my medical career, and then my beautiful wife up in the top right. I gotta give her a shout out. I don't think she would be embarrassed if she knew that, but she has helped me more than she knows. So I always gotta say thank you to her. Okay.
Thank you so much, Dr. Fountain or Dr. Mack. Um, that was a great presentation and we really appreciate it. If you don't mind, we would love to transition to some Q&As. We have a few that have utilized the Q&A chat feature, and I did receive a handful of emails with some questions.
Okay.
A few of them I think you may have touched on, but just
Mhm.
would still like clarity if possible.
Yeah.
The first question is, what are signs of OCD in school age kids that should raise concern about getting help?
That's a great question. So a lot of times in school age kids, they aren't able to understand the process of OCD. So in OCD, we have obviously these obsessive and compulsions that we have to do. In school age kids, we're going to see a little bit more about the compulsions than you will see the obsessive thoughts. Um, in adults, because we're able to kind of track our thought process a lot easier, in adults, we think like if somebody is thinking this way, then they have OCD. So something that um, might be a thought process that a adult has and is able to explain to you is if I walk into the room with my left foot first, something bad is going to happen. So if I'm not thinking about it and all of a sudden I walk into the room and I walked in with my left foot first, I need to go back and I need to walk in with my right foot. This is a very specific example, but um, and they have that thought process so they can help explain it to their doctor, their therapist, and kind of would clue us in a little bit more. In children, we're just going to see a lot more of the compulsive behaviors without somebody explaining that thought process to us. So, yeah, they might do that same thing, but they would never say like, "Oh, I need to do this or else something bad will happen." Um, Something that we always think about with OCD is the kind of typical OCD, or not typical, but the one that I think gets brought up the most is um, a fear of like germs and bacteria. And while some kids may have that and they may need to wash their hands many, many times a day, um, a lot of times that's not the case. We may see kids that do a weird thing with their hands sometimes. I had a kiddo um, without HIPAA or anything like that, but would do something weird with their hands. Something similar to like if they touched a counter, they had to touch it with their left hand right away. So they would kind of do this like tapping motion on the counter all the time. Um, so we'll see a lot more of these repetitive movements or behaviors without understanding that thought process that goes behind having OCD, that we may be able to understand more when we're adults and can kind of explain our actions and our thought processes better. So that's what I always look out for if we're doing things repetitively, like every time we get into the car, they have to get in this way or they have a meltdown. That being said, especially at very, very young ages, too, or kind of terrible twos, threes, we might have a meltdown for anything. But specifically for OCD in the school age kiddos, it's very much like this has to happen or else something really bad will happen. But they can't communicate that very well. So a lot of times you just see a lot of the repetitive behaviors and the need to do something without somebody explaining that thought process.
Thank you.
Mhm.
Our next question is, if you are an adoptive or foster parent, you may not have been in your child's life during the very formative years. How
Mhm.
long does it take to rewire brain functioning in those pathways?
Yeah, so that's a great question. It honestly depends on how young they are. So, we, if obviously we're in infancy, it can happen a lot quicker as long as we're able to be that safe, stable, nurturing environment. If we're in our teenage years, it may take a year to 2 years to kind of get that feeling of I'm safe when I'm home. And that's really what this is all about, is kind of that feeling of I don't have to be stressed when I'm home. And if we are a foster kid who unfortunately has been in the system and bumping around, um, may take a very long time to feel really safe. And it even takes some time after we feel safe to have those pathways in our brain switch to a different route where I no longer have to be worried if I hear a noise. I'm no longer living in that environment of toxic stress. So it really does depend on the age, but I've found in teenagers it typically takes a couple of years to fully get that big sigh of relief, Even if they do feel better But to kind of get those pathways changed will take quite a bit of time. But as long as you're there, making sure that you're a safe, stable, nurturing relationship with the child, that's exactly what they need.
Thank you so much.
Mm.
Our next question asks, when, if at any point, does perfectionism become a concern for mental wellness?
Yes. Um, that is a great question. It is a hard line. It's a hard line. That being said, if our perfectionism is causing so much anxiety that it's affecting our daily life, that's when I would say we need to take a hard look at that perfectionism. A lot of things in mental health don't become a true disorder or a diagnosis of a disorder unless it's affecting our daily life. And it doesn't have to be every day, but if we are having so much anxiety about being perfect that we stay up at night and we're not able to sleep, that would be something that we'd be concerned about. If we are worried that we have to be perfect and we aren't eating because we're so anxious, or we're not eating because we need to have the perfect body or anything like that, that's when it becomes concern, and I would bring it up to your doctor. It is hard because a lot of type A people, myself included, always want to be the perfect student, the perfect whatever. Um, but really, once it's affecting our daily life is the big thing. So sleep, eating, our body in general, if it's affecting any of those three, I would bring it up to your doctor.
Thank you.
Mhm.
Our next question looks like it's a little specific.
Okay.
My child has been diagnosed with ADHD and specifically struggles with impulse control. We
Mhm.
have them on medication and they do see a behavioral therapist.
All right.
Are there anything, is there anything else I can do as a parent to support them?
Uh, One, just being there and talking to them throughout their day, explaining if they're having these impulses, kind of try to talk to them about their thoughts. It is very hard, especially in our younger kiddos. But a lot of times what I like to ask is um, kind of leading up to the impulse. What were we thinking? Was our heart racing? Did we feel angry? Did we feel mad? Did we just feel bored? And what does that mean? Because a lot of times once these kids are able to identify those feelings, they're able to s- get better in stopping the impulse. That's a little bit about what the behavioral therapy is probably working on. So if you can help reinforce that at home, that's really helpful. Another thing is always having more for our uh, fidgety kids. You know, they've come out with a lot of great fidget toys and things like that, if that is something that would help. Impulsivity is a little bit different than hyperactivity, but sometimes I do see that it does help them to have something in their hand, moving it around so that they're always doing a little bit of something as opposed to just sitting there. But what I really like to do is have the parents talk them through their thoughts leading up to the impulsive behavior and kind of helping explain to them that maybe that's not the best choice that they can make when they're having those feelings or thoughts, and what are other choices that we can do to help them, like offering up a another behavior, whether that just be something as silly as like, what if when we're feeling that way, we want to count to 50 or something, just to kind of get their brain into another mindset instead of like, as we're starting to feel those feelings that lead us up into our impulsive behaviors, is there something that we could almost trick our brain so that we don't have those impulsive behaviors?
Thank you so much.
Mhm.
Just looking, I know I had one more question and I
Mhm.
just lost that. I'm so sorry.
No
Uh,
worries.
what language should we listen for that may signal a rise in self-negative talk or self-criticism?
Mhm. This one's a hard one because you may not hear it the way that they are thinking of it, to be honest with you. So obviously there's the big ones like oh, I'm so stupid, uh, I'm so fat, I'm so skinny, I'm so short, I'm so tall, like any physical characteristic. Um, but uh, when we hear those things, it's not about saying, no, you're not, whatever it is. It's about kind of similarly to the impulse. It's like, what makes you think that way? How can we change what makes you think that way? Whether that be, I'm so short, I could never do this. Like, why do you feel like you could never do it? And if they just keep saying because they're short, like that's not a reason that they can't do anything, right? They could do whatever they want. It's just it may be a little bit harder or something like that. That being said, obviously more about being like, I'm so stupid, I'm so fat, and you have a bright, healthy kid in your hands. Um, Not just saying, no, you're not, but really talking them through about what made them believe that way, whether that be looking at things on the internet, looking at other kids at school, something that other kids at school have said to them, um, and really trying to break down that thought process is the most important thing and will help them in the long run. Um, that being said, if there's any talk of hurting themselves, and that doesn't have to be physical, but even mental, harming themselves by not eating because they think that they are fat or whatever they're feeling, um, are all um, not great pathways to be implementing into our brain, and something that I would recommend to seeing a therapist to kind of help rewiring the brain, because that's what a lot of therapy is. It's kind of doing what I just talked about, is helping the child learn their thought process so that they can change that thought process throughout time.
Thank you.
Mhm.
And we are at 1 o'clock, but I do have one last question if you're able to stay on for just a
Totally.
moment.
Mhm.
Um, could you share your thoughts on social media and screen time regarding anxiety and depression in older kids?
Yeah, so that spotlight effect that we talked about, where everyone can see everything you're doing, is just magnified by like 1,000 with social media and anxiety and depression. It's really hard with teenagers, just brain development wise. We don't have the ability to think before we do things a lot of the time. Whether that be we don't have a lot of ability to think before we think bad thoughts or anything, but um, we really believe that everything online is true, and it's clearly not. We think that our friend that, or maybe not friend at school, posted about this beautiful vacation that they went on, that their life is perfect, and then they see that their life isn't like that. So their life can't be perfect, and that they have doubts about how happy they are. And I think it just exacerbates our anxiety and depression, like genuinely 100-fold. I think that's part of the reason that we're seeing this kind of epidemic in our teenagers, is that we're always connected to people and we're always comparing our life to other people. Um, that being said, that still was something that happened before social media, but it just has exploded with social media. Um, that being said, I really don't love kids having social media. Obviously, it's up to the parents and the child, but I really don't see much benefit for kids to have social media um, before their brain has developed for them to realize that people post things and either don't mean it, or they're only showing the best of themselves. Very rarely do people use social media to talk about mental health and things that they're struggling with. It's always about, look how great this was, look at how stylish I am, look at how good this looks, or something like that, which just adds to the compounding anxiety and depression onto kids. Honestly, if I had it my way, I would probably say social media is only reserved for kids 16 and up, and even then I would want 18 and up. Um, But as best as we can, some some household rules that I've seen help out a lot are in general just cell phone use. Um, some things that some parents have done that I really liked was the kitchen or some kind of common area that's not close to any of the bedrooms is the charging station for all phones. So you're not allowed to have your phone at night. When you go to bed, you need to charge it in the kitchen or something like that. So that way we're not staying up late at night just scrolling through and seeing all these like beautiful people on TikTok and how they're living their best life or whatnot. But and then we're getting depressed or anxious about how we're not living our best life, or we could be doing this if we looked like that or something like that. We're not just what they call doom scrolling throughout all of TikTok. So I like that method a lot. And having a very limited time of screen time. So really the recommendation is outside of education, because now a lot of high schools, even elementary schools, are using laptops for most of their learning. The recommendation is about 1 hour screen time a day outside of education, uh, which I think is very appropriate. Kids should be kids playing outside, doing sports with friends, or uh, learning how to play guitar, piano, things like that, um, and really don't need hours and hours of screen time.
Well, thank you so much, Dr. Mack. That was our last question. So I would like to thank you for a wonderful presentation and thank all of our attendees for a great Q&A session. So thank you again, and we hope everyone has a great day.
Thank you guys.